All right, welcome. If you're gearing up for your practical assessment with Paul from the First Aid Garage, you've come to exactly the right place. Think of this as your rapid-fire study guide to really lock in those hands-on skills.
You've already smashed through the online theory, which is fantastic. So, what we're going to do now is just focus on those practical steps, the things you'll actually be tested on to make sure you walk in there feeling totally confident and ready to go. Okay. Let's dive right in.
We're kicking things off with two really common emergencies. And these are scenarios where what you do in those first few moments is, well, it's absolutely critical. Acting fast and knowing your stuff here really can make all the difference. Okay, so your assessor is going to want to see that you know the difference here. A partial seizure can be tricky, right? It might just look like a blank stare or maybe some twitching, but a generalized seizure, that's much more obvious. You're looking at a loss of consciousness and those full-body muscle spasms. Your action plan here is simple, but it's so important. First step, make the area safe. You got to clear things away. Second, time the seizure. Third, you're going to protect their head. And finally, and this is the big one, you absolutely do not restrain them. Trying to hold them down can cause some really serious injuries, so you have to let the seizure take its course.
All right, let's talk choking. The very first question you have to ask yourself is, can they make any sound? You know, if you can hear a cough, a cry, or even a splutter, that's a mild obstruction. Your job is to encourage them to keep coughing. But if they're silent, if they can't breathe or make a sound, that's severe, and you have to act immediately.
Okay, for an infant, so anyone under 1 year old, the technique is a very specific two-step cycle. You support them face down along your forearm, making sure their head is lower than their chest. That little tip uses gravity to help you out. Then you give up to 5 sharp back blows. If that doesn't clear it, you flip them over and give up to 5 chest thrusts with 2 fingers. You just keep repeating that cycle and get someone to call for help.
Now, for a child over 1, the technique is a little different. First things first, get them to cough. If that's not working, you'll lean them forward and deliver up to 5 sharp back blows. If that still doesn't work, you move on to abdominal thrusts, what people call the Heimlich maneuver, and give up to 5 of those. The key is to check if it's worked between each set of actions.
Okay, moving on. Next up, we've got bleeding and shock. Now, these two often go hand in hand. A major bleed can very quickly lead to shock, so you really got to be thinking about managing both at the same time. Let's look at how that works.
So this number here, 1/3, it really puts the danger into perspective, doesn't it? If the body loses just 1/3 of its blood, it just can't function properly anymore. That shows you just how fast this can become a life-threatening situation.
So here's the procedure you need to know for a major bleed. First thing, gloves on. Then apply firm, direct pressure right on the wound. Grab a sterile dressing and apply it. If it bleeds through, add a second one right on top. But, and this is a key detail, if it still bleeds through that second one, you've got to take both off and start again. The reason is to make sure your pressure is actually getting right to the source of the bleed, not just soaking into the dressing.
And while you're managing that bleed, you've got to be looking for the signs of hypovolemic shock. That's basically a failure of the circulatory system. The classic signs are skin that's pale, cool, and maybe a bit clammy or sweaty. Their breathing might be fast and shallow, and their pulse might feel really fast but weak. They might also just seem really anxious or agitated.
So if you suspect shock, your treatment plan is super logical. First, call for an ambulance straight away. Then, treat the cause. You know, like that major bleed we just talked about. Lay the child down and, as long as their injuries allow for it, raise their legs up. That helps blood flow back to their vital organs. And finally, keep them warm. A blanket, a coat, whatever you've got to stop them from losing body heat.
All right, let's get into the real hands-on stuff. Injuries to bones and joints. This section covers what I think a lot of people find kind of intimidating, and that's applying a sling correctly. But don't worry, we're going to break it down and make it super straightforward.
So first, let's just get the terms straight so we all know what we're talking about. A fracture, that's any kind of chip, crack, or break in a bone. A dislocation is when a bone gets forced out of its joint. A sprain is an injury to ligaments, and a strain, that's for muscles or tendons. For those soft tissue injuries, the sprains and strains, you just need to remember one word: RICE. It's a really simple 4-step process. R is for rest the injured part. I is for ice, but remember, always wrap it in something, never put it directly on the skin. C is for compress, using a bandage for support. And E is for elevate the limb if you can.
But, and this is important, for a suspected fracture or dislocation, your priorities are totally different. Your number one goal is to stop it from getting any worse. So, you immobilize the limb in the exact position you found it. Don't, whatever you do, try to straighten it out. Call 999 immediately and just keep an eye on them for any signs of shock.
Okay, let's tackle the support sling. You'd use this for things like a broken forearm. You're going to place the bandage under the injured arm, bring the top end up and around the neck, and then tie the ends together. Here's a pro tip. Tie the knot in that little hollow just above the collarbone on the injured side. That way, you're not putting pressure on the back of their neck.
And then we have the elevated sling. This one's great for things like collarbone injuries or if you're trying to control bleeding from the hand. The whole point here, the key thing to remember, is the position. You want their fingertips pointing up, towards the opposite shoulder. That elevation helps reduce swelling and pain by letting gravity pull blood away from the injury.
And there you have it. You've literally just run through all the key practical skills you're going to be assessed on. So, to wrap this all up, let's just quickly go over the 4 golden rules that you can apply to, well, pretty much any emergency you'll ever face.
No matter what the situation is, whatever you walk into, these 4 things always apply. First, check for danger. To you, to the child, to anyone else. Second, stay calm. That's how you'll be able to think clearly. Third, call for help. That's 999. And finally, always wear your gloves. It's all about preventing cross-infection.
And that's everything. So when you walk into that practical assessment with Paul, just remember, you have the knowledge and you have the skills to act calmly and to act effectively. You have done the work. You are prepared. You've totally got this. Good luck!